My name is Jason Woods, and I'm the Peer Support Team Coordinator for DC Fire and EMS. What is peer support? Peer support are trusted colleagues who act as a link between members of the agency who may be experiencing acute or long-term stressors and connecting them with the appropriate clinicians or treatment facilities who can assist them in overcoming these challenges. Our team currently consists of 45 members. Each member undergoes 24 hours of initial training, followed by 20 hours annually of continuing education. The fire service has taken great strides in recognizing that the mental health of our members needs to be addressed. We're trying to break down the stigmas and the barriers related to mental health and people asking for help to ensure that we have a healthy workforce. Our members are no different than the general public. We all have problems outside of our job. It could be marriage problems, it could be financial problems, sick children or parents that our members may be taking care of. The everyday stressors that everybody else in life deals with, we're not immune to those. What makes us different from the general public is the fact that we then go into a profession where we're exposed to some pretty tragic events, and we're also taking on everyone else's problems when we go to work. Unfortunately, the fire service has recognized that over the past 10 years, we're losing more firefighters in this country to suicide than we are line of duty deaths around the country. Our own agency a couple of years ago had 3 suicides within an 18-month period. 2 of those were active firefighters and 1 was a recently retired firefighter. Over the past year, of course, the world has been crazy. We've had COVID, we've had, our city is unique that we consistently have protests going on in the city. Any given day, there's probably a couple of different protests. Most of them smaller, but over the past 12 months, COVID has not really been something that our team has struggled with providing assistance to our members for. What we have had is we've had over 450 interactions with the members of our agency since January 1st. This ranged from the 100 and some members who worked at the U.S. Capitol on January 6th to the death of 2 colleagues, both off the job, not job related, but death of 2 of our colleagues, one actually from COVID. We've had a number, unfortunately, of child-related deaths in the city over the past 10 months. Unfortunately, a lot of these come from active violence where we're seeing children that are shot, and that has an impact on our members. It could be, again, a shooting. It could be members who are exposed to the death of a child from a car accident. This tends to weigh a little heavier on our members, especially since most of our members have young children at home. Some of the stressors that our members deal with aren't much different than the general public. It could be depression, anxiety, substance abuse, mainly alcohol, suicidal thoughts or tendencies. And the other thing is post-traumatic stress or post-traumatic stress disorder, just from the exposure, some of the things that we are exposed to within our profession. Moving forward, we're actually have a budget meeting in the next couple of weeks with the fire chief. We're trying to increase the amount of resources we have for mental health for our members. Some of the things we're looking at are community partnerships, potentially internships with some of the universities, building a resiliency program to make our members more resilient so they're able to bounce back quicker after being exposed to a tragic event. And the other thing is focusing on the families of our members. These things have an impact on the firefighters, but it also can have an impact on their home lives as well. We do have higher divorce rates than a lot of other occupations, and some of that could be stress related to our job. So we are also looking to start to reach out to the families of our members just to make sure that we can include them in the conversations that are going on about mental health. Maybe have them act as a active participant and recognize maybe when their spouse is in distress. But we want to make sure that the families of our members are taken care of as well as our members. So thank you for allowing me to speak. I appreciate it. And please reach out if there's anything we can help you with.
We have another CPO in progress.
We're having an issue right now. They just stormed the gate.
There's someone down, and he's having a hard time breathing.
Protesters fist fighting with Metropolitan Police Department officers on the West Terrace.
I knew the police were overrun at that point.
The resources that we had in place were quickly overwhelmed.
I got spat at a couple of times, got called the N-word.
It resembled more of things that happens in war zones than it does in our nation's capital.
GMPD has declared this a breach at the Capitol as well as a riot at the Capitol.
We do have one shot in the chest. Need the resources up here now, immediately.
Bring the patient out. We cannot make way through the crowd.
Patients coming out, patients out.
There hasn't been that many times where I'm in fear of my actual life.
We were monitoring the Capitol, we were monitoring areas around there.
We were able to put a significant amount of additional resources in service with no notice.
You're going to have to stage units on either side, and then you're going to have to figure out an access point for the Capitol.
They had like these weird bugles they were blowing, like something like from the Planet of the Apes, like Charge.
CPR on the Capitol police officer.
It just made you realize how much hate is there.
It was kind of a privilege to know that we're part of a department that's responsible for the good and welfare of those buildings and the people inside them.
This is the greatest fire department in the world.
Hi, I'm Dr. Ismail, and I'm a first-year emergency medicine resident. As a resident and new physician in the era of COVID, it's been interesting to say the least. It's also been extremely emotionally and mentally taxing. COVID has changed the game up. It's caused a lot more deaths than we'd ever imagined and continues to cause a lot of deaths. I never thought I'd be the one to pull life support on patients so soon in my career, or to be the one calling family members nearly on a day-to-day basis, letting them know that their loved ones have passed on and lost the battle to COVID, from individuals as young as 34 years old to individuals as 80 years old. It's been a difficult path for sure. And unfortunately, it's also caused a lot of mental and emotional strain on healthcare workers and has resulted in a national shortage of nurses, simply because of the fact that individuals have had to reevaluate whether this is a career path that they want to continue taking, where we feel like we're in a battlefield and we continue losing. There are a lot of successes, no doubt, but these hardships have been extremely overwhelming. With that being said, I'm an extreme advocate for mental health. I always want to advocate medical health workers seeking mental health and seeking out the help, not just from loved ones and family members, but from actual counselors, to just kind of be able to release and have individuals help us go through these grievances, these emotional difficulties, and these mental health strains that we're going through at the time. Thank you.
Hello, my name is Andrea Florence, and I am a registered nurse. I've been a registered nurse now for 11 years, and I currently work in correctional health care. As a nurse, I believe mental health counseling is so important, not only for our patients, but for healthcare workers. We experience a lot of highs and a lot of lows, and I believe sometimes as caretakers we're overlooked. In correctional health care, there are psychologists and mental health counselors available 24 hours a day. However, I do believe that the level of care could be a bit more intense. A lot of the patients that are incarcerated suffer from mental illness. With the extremes vary, but a lot of them suffer from mental illness, and a lot of it correlates back to their crimes. It usually comes full circle. So I believe that if we had more mental health counselors and advocates in our community, it could make a great difference.